spell funny. It's
I know that
just,
was that.
it's easier. Everybody can see it. Can you please erase that board right there?
Really?
Worst part is we got up to do it.
You can't reach
I wanted that one video.
That's why I did it.
Right, that's good. Thanks, assistant.
Oh.
Erase everything.
So the 4 companies you're going to need to do through Messer. Here's Troy's favorite company,
Oh yeah.
American General.
Hello, darkness, my old friend.
IHC. Assurity. And CUO, which is Central United Life. These are the companies that are going to have our critical illness and hospital indemnity and accident plans, along with the dental. That would be right in the software that will integrate with your health plans, all right there. So essentially, what's going to happen with the software, and we're going to have a video conference on it here shortly. I just got it in today, but what's going to happen is you can sit there and show somebody just a plan by itself with just a health insurance. You kind of give them the best, better, you know, you do 1, 2, 3, 4 plan, everyone do it. The cool thing about the platform is you can build it for them. You can talk to them on the phone and say, I'm going to email your quotes right over to you. Tell me which one you want to pick. They can sign off on right there and be enrolled in 10 minutes over the phone, which is pretty cool. You can do it in person. Like I said, they scratch your finger on it and it's done. But it's going to help put us all together into one. It bypasses healthcare.gov, so there's no creating an account form, which was one of the longest problems about, hey, can you go check your account for the email? No longer of that. No longer on the identity. You don't have to verify their identity. That's all done on the back end. That's still a problem.
So if there's issues on the back end, they'll just get an email later saying, hey, what's the problem?
What kind of issues do you mean?
Well, you said they're gonna do it on the back end, I'm still gonna have to verify.
No, actually, the software actually has a back end way to healthcare.gov.
That's what I mean.
It's its own feed, so they're already getting the information. It doesn't matter, healthcare.gov, the front of it, we're never even going through.
Good.
So we should never have a problem because the software is built for a limited number of people. And so it should not have a problem, just go right through there. And what happens is once you put all the information in, let's say, you know, I was talking to you on the phone and said, Jim, you know, I need all your information. You can put the information in, the family information, the income, and then what happens is it goes and gets the subsidy for you, brings it back, incorporates it in the quotes right there. So your final quote is including all of that. And then what happens is Jim says, yeah, I want this. You can go put the banking information in, okay, what day of the month you want, it's done. So we're not gonna have problems with going and chasing down people for premiums this year. It's gonna be the same thing, just such a, you know, same as life insurance. We've gotta get a method of payment. And without a method of payment, you can't do it. But everyone, you know, with life insurance has a method of payment too. But I mean, ask Jeremy how much fun it was to try to collect money from people.
Is that sinking in, everybody? There is no more logging into Consumer's Choice. It's an automatic bank draft. That's huge.
Yeah. It's all done through the software and all, again, it brings, let's say you help build somebody a health quote and you have a CI, a critical illness, and you have an accident plan, and you have a dental, and the whole thing comes out to $139 a month for the whole family. That's all they pay is the one premium. The software divvies it up to where the company is supposed to go.
That's what I asked.
And so it makes it so much easier for us.
So it is just one premium that's coming out of their account.
Well, I know, they're gonna have 4 premiums though,
Oh,
because
so
it's
they're
different
not-
from the companies.
Alright.
But those companies are all being told this is time to do it. It's all coming out the same day.
Oh, okay.
But according, you know, all they need to know is that that's the one premium that's coming in.
Like you said, you had some trouble last year, a lot of people did collecting premiums, so if they do not have a checking account, then what?
Stuff like that, I don't have the answer to because I don't have the actual, I've seen a demo of the software, but I haven't actually worked the software. That's not gonna be available until they get the rates, which have not been released yet from the companies. So they're saying somewhere between 2 to 6 weeks, they're saying worse, November 1st, we'll have it.
I got a client that lives within walking distance of the Consumer's Choice office, and she walked her payment down there. I mean, she doesn't have a checking account.
Sure, but think about this. I can tell you right now that more than likely, most of everyone in here that gave somebody a health insurance plan may not have been the best plan for them. It just covered their health insurance policy, so had deductibles, had things that come out of their pocket. You know, if you can build a plan that includes that, includes something, may not include all of it, maybe just includes the accidental part. Because they know that most people have to go and use their deductible, a lot of it's because of an accident. You know, it's kids playing football, you know, your kids all play sports. Somebody getting hurt and having to go to the hospital.
No, that's not happening.
Okay, sorry, we're not going there. But it could happen. We were in Myrtle Beach this weekend. My 2-year-old was jumping on the bed and fell off the bed and hit her head. Didn't have to go to the hospital, but it could have happened. That's accidents are the biggest thing. The second biggest thing of going and using your deductible, most people don't have to use their deductible on a true deductible plan with health coverage in there for going to doctors and everything else. They don't truly use it for something besides accident or a critical illness. Somebody gets very sick with a mini stroke, a heart attack, you know, some cancer, things like that. So if you can start adding in the critical illness and the accident plans, and a lot of times critical illness, you can have a $25,000 critical illness, a $50,000 critical illness, your deductible maybe $3,000. So it's covering that, plus they want to get specialized care, they can go do that, which is awesome. And how many people really have wanted dental? And you've gone back and done a lot of them, what if you automatically have it in every quote?
So this won't be through Medico?
The dental? No. That won't be. It doesn't mean we're not gonna still sell the Medico, but yes.
Will the dental plan that we'll offer through Messer cover under 18? Is Medico?
Again, I don't have all this, I don't have everything,
Not a problem.
because I myself am just now putting myself through there too.
Gotcha.
I'm just slightly ahead of you, not much.
You were saying that some of the plans that we put folks in last year may not have been the best plan, but typically, I mean, a majority of the plans I was doing was where they got a subsidy. I did the silver 2, and their deductibles knocked from like $3,000 down to $500.
There are some like
That's the
that.
majority.
There are some like that. But even at 500, I mean, what if you could hit $1,000 deductible, just a little bit higher, save that premium and put it into an
Is
accident.
life insurance an option on this, Scott?
Yes, some of these, like, I know Central United Life does have life insurance, and it is going to be built in the software. I need to say again how much. So yes, that is something you can build in life insurance. This is going to be really big. You know, when you start talking about very small businesses, 5, 6 people, you can build a benefit package for them, a true benefit package. People that aren't getting a full subsidy, they're just getting some of the premiums down. Now you can build in some of this stuff that's really going to help them. And it's going to give them a package. And where do you think they're going to go next year when it comes back up for renewal? They're not going to go to Dan because Dan's just giving them health coverage. And hell, they got their critical illness and a dental and a life for you. So, sorry, Dan.
Same stuff he's got.
So it's going to be a really cool way of packaging it. It's going to be very easy once you learn it. And because none of us have it right now, but once we all learn it together, we'll be doing it the right, the right way from the beginning. The hardest thing, about MAs, we're going to be doing a lot of training on that. Building in the hospital indemnities, building in the dentals. It's a little bit harder because people have sold MAs for a couple of years and just selling MAs, not knowing that there are other things we can do. We're trying to provide a really good full service to our clients. And that's a big thing. Plus, we want to make sure that we're also making money on our side, not wait until February, March to get paid. Because, I don't want to wait until February, March to get paid. I know you guys don't. And so, we want to make sure we're building it the right way. We're getting them the best products they can have, which is why we're adding all these companies. I mean, we've added 8 companies in the last week. And trust me, not everybody wants to sit there and just click and add companies and have to, fax things back and email back and all that kind of fun stuff. One of the good things we did find out is, one of our new carriers that's coming on, which is Assurant Health, is going to be advancing some commissions, which is a good thing. So that means that if you go ahead and you sell an Assurant Health plan in November, you'll be getting paid some commissions on that in December, which is really big because most of the other ACAs last year, we didn't start getting paid until about March. So I think that's going to be a really, really big thing. And again, we're going to go through some of this training once we get everything in and we get the platform and actually train on what the benefits are. But the cool thing about the Assurant, it is the only PPO plan that is on the network. And for those of you that know, from the point of service, the HMO plans that are out there right now, the PPO plan, you can go in or out of network. pretty cool. Assurant's gonna be the only health insurance company on the network this year that's gonna actually include all the local hospitals. So again, it may not be the lowest price, I don't know yet, just kind of speculating from what I've heard from everybody, but it may be the most friendly, network. So if you have a husband that wants to go on to MUSC and likes going down there, and a wife that loves Roper, and is never changing her doctor from Roper because she sees it all the time, that may be the best plan for you, but it gives you an option. Last year, you had to tell them that, hey, you wanted the Roper plan, okay, you can get it at Coventry, and we're gonna do it because the wife's the most important part of the family, and the husband, you only go to the doctor once every 4 years anyway, so you gotta change doctors. This year, they wouldn't have to do that, so it's gonna be really nice. Plus, what they're saying, and again, I'm going on hearsay right now, so they said they're gonna do the 6-month advance, which is pretty cool. So I'm pretty excited about that. A lot of stuff in there.
Will it go out of state?
Health insurance is all per state. Every state is different.
Okay.
So again,
But under an emergency situation, they can.
always emergency situations are always going to be covered.
Well, I've got at least 2 clients that, they live here, but their husbands live and work in another state. And then they're constantly coming back here to visit, but.
But again, coverage is, the way healthcare reform is built is everyone that's on a federal exchange, you know, what was it, 39 or so states are in federal exchange, something like that? And there was 12 or so that are in private exchange, but the ones that are in federal exchange, they're all gonna be similar, but they have different companies that cover different states. So you can't get your coverage in South Carolina, but going and living in Ohio. It goes by where you live and where you file your taxes. So,
They file their taxes here.
Scheduled surgeries have to be done here, emergency is fine there. There has to be a scheduled knee replacement, shoulder surgery, has to be done down here.
Well, if they have something
This
like,
has to be the illegal resident.
if they have one of the PPOs, you know, a lot of the plans like Aetna, you know, they have they have open access plans, so if you just, for each individual carrier, they're gonna have to call the carrier and say, if I'm here in ABC part of the country, how is my bill gonna get paid?
Yeah.
Because every company's
Now,
gonna be
again,
different in how they're gonna cover it.
things like this is where this may come into play and be really good popular plan for that kind of client, because Assurant is using the Aetna network next year. So Assurant, Aetna's not even using the Aetna network. Assurant leases, kind of funny, you know, Aetna's, you're busy buying Coventry right now, so they have their own network, but Assurant actually leased the Aetna network from Aetna. So they're using their PPO network, which is one of the larger PPO networks. They are in multiple states. The Aetna network's one of the largest out there. They do have all of the specialized care that people are concerned about. All the, what's the real big hospital you like to go to? No, like nationwide, where they get specialized care, like cancer treatments, things like
Cancer
Mayo Clinics.
Mason.
All the Mayo Clinics are in network for them. John Hopkins also in network for Assurant. So, I'm not a health person. I'm not a doctor. I didn't play one No, I don't look bad. So that may be a place for that. But again, that's gonna be for later, once we get the benefits. Let's worry about those kind of plans. We're gonna be able to teach us. We don't have those yet. So I can only give you what I've learned hearsay from people so far. That's pretty much the ACA. So if you can please enroll in these companies today, and John, we're going to put those on the grid so we can make sure that we gets to do this today. And the other the other good thing about, and again, I don't have all the full details. Mike and I are working through that. But the agency platform, we did get it down cheaper for everyone, which is really awesome. It's not going to cost to enroll in the platform. Remember, we said it could be up to $79 to enroll individually. They're gonna build us an agency platform, so you're not gonna have to pay for that. Again, the fine details is the most that it could cost you is up to $25 per month, which is pretty cool. Because again, we were talking about $79 and $79 per month. Now that first $79 is gone. The second one would be if you wanted to build the database inside of that. And I think most people are not going to do that, so it probably will not cost you at all, more than likely. But the most it could cost, again, I leave it out there because it's not quite done yet, is $25 a month, which is much better than the $79 a month and the $79 to set it up. So I think that's pretty good news.
We would just be using it for the months during
No, you can enroll people all year long. That's another thing we'll get into later. There's some special enrollment opportunities that we missed this year. Again, it was our first year, and we jumped into it as quick as we could, and I tried to get people to enroll as many as we could. We missed a lot of opportunities. We're not gonna miss those this year. So once, the biggest focus is to get the platform, to understand the platform, to understand the coverages, and to get enrollment started November 15th, when it opens up. Now, it's open from November 15th to February 15th. But we're gonna talk a little bit about, there's a lot of opportunities of small business and things you can enroll year round. And you can enroll it individually. It's a different conversation than one really have right now. But we use this all year long, which is pretty cool. And it's so much easier from what I've seen them do. And of course, they make it look easy when they're doing it, but it really could be a 10-minute enrollment. It may be something that'd be very, very, very similar. The other big thing that we were working on was the Walmarts for the MAs. Let's switch off of ACA. Get these done in ACA today. Switch off over to the MAs. Who is interested in doing the Walmarts this year?
Oh.
Oh, as a wait for hands to slowly go into my those.
It's a booth inside Walmart.
Okay, yes, I don't even know what it is, but
So
sure.
why you raising your hand?
Well, because she likes Walmart.
Yeah? Yeah, you know what that means? You gotta be a cashier for the rest of the year. That's what it
I live right next to Walmart, and I trust Cheryl. Cheryl told me to say yes, I trust her. So yes, I wanna do Walmart.
means. Good, you're cleaning bathroom until December.
She moved down from
Okay. Alright, well here's the deal. There's only a couple of Walmarts locally left. And again, I was looking at locally and what was available. There's only 3 of them locally right now that are available. There's a couple other ones, like one in Walterboro, one in Orangeburg. But I mean locally, I mean pretty much inside the Charleston area. There's only 3 that are available right now. The deal is, as you guys probably saw in all the little emails that you saw earlier, it's $500 per Walmart. Now that's for the Walmart for the entire 7-week period. Now, we're doing reporting. If we do the reporting the correct way, like we did last year, then they will reimburse half of that back. Now, what we've got them to do is to not charge us at all until after we start getting paid in January. So Messer is willing to go ahead and put that money up for us right now. So whoever wants to get into the program, I would preferably like to have 3 to 4 people per Walmart store that wants to do it. And again, it's going to bring the cost down. But we're able to go ahead and put the money up front, so you don't worry about paying for any until you start getting paid from your MAs, which I think is pretty awesome. Because then, MAs, you write 50 or 60 of them, you're going to get a big check of 10 or 15,000, whatever it is. And math just kind of threw it out there. But it's going to be $125 per person if we get 4 people per store. Now, if we get the reimbursement back, it's going to be a little less, so we have a little bit of money to reimburse back or do an extra lead drop at the end of the season or do something with. We haven't quite figured it out yet. But now, who would think they want to do it for the $125 for the 7 weeks?
What stores do we have? Yeah, what stores are the 3 stores?
They're all local. I mean, one's in Charleston on James Island, which I think is a great store. That's actually our perfect clientele. One on Rivers Avenue, one here in Somerville on North Main Street. So it's kind of one up here, one in North Charleston, and one in Charleston. So it is pretty well. The only one I didn't have is Monk's Corner. I really kind of wanted that one because it kind of goes up and gets people up in Goose Creek, Monk's Corner, and up in.
What about the one on Walterboro? Can we have that one too?
We can't. I've got to tell them today which ones we want to have.
Let's just
Because,
list the stores up there and put the people's names so they're committed to it.
I mean, yeah, I don't mind leaving the list of stores, but
But don't you need to know that?
the only ones locally, when we say again, Ronnie?
Where?
No, the only ones locally really are James Island.
You don't know what you're getting into.
I'll get my assistant to put them up here.
Okay. Have fun.
Yeah. Yeah, the only ones locally is Main Street here in Somerville, over on James Island, which is on Folly Road, and on Rivers Avenue, North Charleston.
That's not the big one at Tanger.
No.
Where is that?
I don't know.
Rivers Avenue is at the corner of Rivers and Ashley Phosphate.
Yeah.
It's right there behind. It's actually right perfect area. To go westbound.
pretty
that's the
busy.
one that's tucked back in behind the key bank?
Yeah.
Okay.
Yeah, it's a pretty busy Walmart.
I'll do that.
Okay, so actually, we got 3 really good Walmarts, one in Somerville, one over in Charleston, and one in North Charleston, so I think really good locations. Those are the ones that are local available. Ones that aren't quite as local is, there is Walterboro, there is Orangeburg, and there is a couple of Columbias.
No, it's gonna go to Columbia.
How many hours do they tend to be made?
20 hours, same thing as last year, except for, the cool thing about this one is it's not run by Blue Cross Blue Shield. It's actually run by a different company, which, what's the name again? Direct Health is actually who runs it, which is why they're charging for it. They got a 7-year contract. So for the next 7 years, Direct Health is going to be doing this, running this. But the cool thing is they are building real kiosks. And for those of you, I didn't bring it down.
Yeah, your phone's over there.
Oh, it is? There we go.
It looks fairly similar to last year.
Now, is it Medicare Advantage?
Only like 2. Most of our Blue Cross last year was a bench like this with a chair. You got lucky, Matt, whatever your name is.
Pretty. I put flowers and lights all over.
Hey Scott, is this Medicare Advantage rules or is it?
No, that's the cool thing about it. You know,
So we don't have to report the specific hours we're gonna be there?
no. But we just need to do a very simple schedule reporting back to it whenever you work.
He'll put me over in Main Street.
Me too, Matt.
I won't walk the
If we report, we get half the money back. So
Well, no, I mean if it's that you can't go in there any extra hours.
What is it?
It's fine.
I know, but for sure, I guess that won't mean YOLO's today.
Yeah, if you put 5 per store manager, it just drops the price.
it does jump the price. So here's what the kiosks look like.
Crystal.
So they're actual real kiosks with sit down desks that you can actually write business at right there, which is pretty cool.
It's pretty similar to what we had this past year. That same color, that same booth was there.
Only a couple people did. Most of them had benches.
We had that.
But the cool thing is, this company actually will guarantee that they're there. They will be taking them out of the stores like on Thanksgiving and on Black Friday and putting them back into stores for you. So they do all the work.
So we can't work them on Black Friday?
You cannot work on Black
They
Friday.
changed it to Brown Friday.
Black Friday has to be-
The other cool thing is,
HR.
alright, listen up. Alright, the other cool thing is, you can bring all of your MA companies in there. You don't have to just, you don't have to just look at like Blue Cross Blue Shield and Humana. You can bring everyone in there at one time, and as long as you have a scope of appointments, and if somebody wants to change the talk about another one, you just sign into the scope. There's essentially no rules on talking about one company or another. You can also talk about ACA while you're there too. So it is very different this year. I think it's actually a better opportunity, because think about that, you have 30 people that come by and talk about ACA also. November 15th all of a sudden comes around, and your MA season's starting to wind down a little bit. Now you got 30 people who are going to see about ACA. Or you know, kind of like I talked about before, where you can input them in the system. We're going to create a form to get all the information, input in the system on November 15th. You send out 30 emails to all the clients that you met. And here's your quotes for your ACA. You could literally be sitting in the office and helping enroll about 20 ACAs on November 15th. I mean, think about starting that in November and having 20 done. That'd be kind of cool. So there's a lot more opportunities this year, and I think the Walmart is a great opportunity. I know it costs a little bit of money, but they're willing to reimburse a decent amount of it back. And how many enrollments do you have to do to pay that money? One? I'm pretty sure that you'll get one out of there, especially from all the different companies that you have. And I guarantee you'll get ACAs out of there, because last year I was only there, I think, 2 days, and I had about 25 people come and ask me about health insurance. And the cool thing about these, if you look at them, it talks about healthcare begins here. So it doesn't say anything about Medicare, it doesn't say anything about a specific company. It has a place for brochures, a place for time on the outside. I think it's pretty awesome chance. So
Were we gonna have any kind of, like separate signs made to go in conjunction with that piece to say something like Medicare open enrollment, ask us, you know, or something?
again, on Medicare side, we're still gonna be very careful. I'm sure we can order some stuff that companies already do, or it's already been out there generically. But on ACA, there's almost nothing.
Right, you know.
So I like keeping it just health exchange,
Right.
because then people come and ask.
No,
Well, what do
I
you- what's
understand,
health
it's
insurance?
just the way, like, with last one we did, the signage was there, but it's a little bit small, and people have to really kinda look at it. I was just thinking of a sign, it's just block letters, it's very basic, but just says,
Yeah,
you
it's a
know,
great
nice
idea.
and big, it's just dumbed down to say Medicare information right here, something stupid like that.
And they may have some of that. I don't know what exactly they have. We'll have to find out details.
Alright,
Once I get these enrolled, I can get more details.
yeah,
It's tough to ask questions when you're trying to get all of it. And,
yeah, no, I understand, it's just,
yeah, no, I agree. It's
simple
good.
signs like that, people respond.
But they
very
redid the
quickly.
booths from
Trust me,
last year, right?
Hey Gary,
Yeah, oh, here we go.
if you want somebody to do it, Matt can do it for you.
I'm not going.
Yeah, he did a good one.
It's a mess. I got picked on 'cause it's sloppy.
He sent me a picture. He had handwritten.
I got no problem.
Roll here.
Matt, I thought it was good.
Yeah,
I thought it was good.
So, okay. Whoever is not here, any of your team members aren't here, can you please call and see if they want to be involved? I don't want to say somebody wasn't here and did not have a chance to be involved.
They should have been here Tuesday.
Bill McCurdy can't walk.
But he's not my agent.
I know, but I'm saying, it's not very nice.
Well, that's what happened to Bill, was they out?
Yeah. I mean, they can't have Teresa miss just because she's in the hospital. Well, it's her fault. She wasn't here.
She's not my agent.
Really appreciates being recorded.
So we just want to stay with these three stores and everything? We don't want to worry about the Baltimore store or
How many
any other
people
ones?
would do the
About
Walter?
20
Do the
outlets.
Walker store. No,
It's gotta be covered 20 hours.
But you would have to do
I
it
can't do
20 hours.
20 hours worth though.
Okay, I mean, it doesn't matter. I want to make sure they're manned. I'm not going to sit there and babysit and make sure who's going to be there or not. I want people that have skin in the game that are going to do well and be there and do the.
Well, I can't do that one and all the Walker by myself. There's
Yeah,
no way.
no, I agree. I wouldn't like you to. But I just want to make sure.
I'll help you.
I just want to make sure.
There's a lot of clientele that goes into that walkthrough.
Like you sold anything in Walterboro?
If you can get other people to do it, I would be.
I mean, right now you got
Not.
you got 6 people over there.
Walterboro's in Walker County, right?
Yeah,
It's it's,
that and St. Stephen's.
So, Susan, where'd you go over here?
Yeah, I'm at Rivers Avenue.
Well, why don't we pick you and Lynn and try to have somebody else over there with you in Walterboro and split it up at least with 3 of you.
Teresa?
You gotta ask Teresa's permission for that.
She's got leasing right now. It's another $500.
What's her cut?
It doesn't mean you can't go to the other store too. I mean, once we have the hours up, if there's another, 20 hours are filled and there's still some days you want to go, it's our booth. No one else can go in there. So once we commit to these stores, they're ours.
Meet me on Rivers Avenue.
So if we left over there.
Other place they can go in?
No.
Because.
It's 20 hour minimum per week, that's all. It's 20 hour minimum per week, that's it.
Well,
Doesn't matter who
why
does
I'm
it.
sticking
Yeah.
with 3 to make sure they're really well manned.
Yeah.
Let me ask Bill real quick. I want to give him an opportunity.
Bill would probably want to do James Island.
They'll either do James or Rivers, I would say.
I'm calling right now.
Can I take you also?
I need 2 for Walterboro. Anybody else want to do Walterboro?
It's 20 hours.
7 days a week.
Well, how about I take you off of some of the...
Saturday afternoons. Friday night was great because they served food right next to
Well, I don't want to do that. I gotta have 4 people.
Yeah, that's fine.
Have you ever seen the
Oh, it is a very big store. You get everybody.
Fountain, Brownlow, Cottage Hill, Genesee,